Aortic stenosis (AS) is an cardiovascular disease. Look at this picture, shows that heart, aorta and aortic valves, ECG variables, chest X-ray findings. Look at this, CT, MRI findings and echocardiogram. Look at this. A detail going on. Introduction. Aortic stenosis is a narrowing of the aortic valve opening, restricting blood flow from the left ventricle to the aorta and then rest of the body. It is a progressive condition that affects both young and old individuals, with a higher prevalence in the elderly. The disease can lead to serious cardiovascular complications if left untreated. A definition. Aortic stenosis is defined as the narrowing the aortic valve, which leads to obstruction of blood flow from the left ventricle to the aorta during systole. The condition results in increased pressure in the left ventricle and decreased cardiac output, ultimately causing heart failure if untreated. Types. 1. Congenital aortic stenosis, present at birth, usually due to bicuspid aortic valve. 2. Acquired aortic stenosis develops over time, often due to age-related calcification or rheumatic fever. 3. Subvalvular aortic stenosis involves a narrowing below the aortic valve, often caused by a fibrous membrane or muscular ridge. 4. Supravalvular aortic stenosis. Narrowing occurs above the aortic valve, usually associated with genetic conditions like Williams syndrome. Causes. 1. Congenital defects. Bicuspid aortic valve is the most common congenital cause. 2. Age-related calcification. Over time, calcium deposits build up on the valve, leading to narrowing. 3. Rheumatic heart disease caused by rheumatic fever. It leads to valve scarring and stenosis. For radiation therapy, exposure to chest radiation can cause progressive aortic stenosis. 5. Chronic kidney disease. Increased calcium phosphorus levels may lead to calcification of the aortic valve. Risk factors. 1. Age. Aortic stenosis is more common in older adults. 2. Congenital heart defects. A bicuspid valve increased the risk. 3. Gender. Men are more likely to develop AS than women. 4. Chronic kidney disease. Increased calcium deposition in the valve. 5. Hypertension. Long-term high blood pressure can lead to valve damage. 6. Diabetes. A contributing factor to valve calcification. 7. Smoking can accelerate the process of calcification. 8. Hypercholesterolemia. High cholesterol levels can promote valve calcification. Complications. 1. Heart failure due to increased pressure in the left ventricle. 2. Arrhythmias. Regular heart rhythms including arterial fibrillation. 3. Stroke. A result of embolization from calcified valve material. For endocarditis, infection of the aortic valve. 5. Sudden cardiac death occurs in severe untreated cases. Pathophysiology. Aortic stenosis causes increased resistance to blood flow, forcing the left ventricle to work harder. This results in left ventricle hypertrophy as the heart muscle thickens to compensate for the increased pressure. Over time, the hypertrophied ventricle loses its ability to pump blood effectively, leading to reduced cardiac output and eventual heart failure. The progressive nature of AS leads to increasing symptoms as the valve area narrows further. The pathophysiology of aortic stenosis involves a progressive narrowing of the aortic valve, leading to significant hemodynamic changes in the heart and circulatory system. Here is step-by-step breakdown of the process. On aortic valve narrowing stenosis to increased left ventricle pressure 3. Left ventricle hypertrophy. 4. Decreased cardiac output. 5. Increased left ventricle and diastolic pressure. 6. Pulmonary hypertension and congestion. 7. Myocardial ischemia. 8. Progression to heart failure. 9. Complications such as arrhythmias, syncope, sudden cardiac death. This step-by-step progression highlights the mechanical and physiological changes that occur in the heart and systemic circulation due to aortic stenosis. Signs and symptoms. 1. Exertional dyspnea. Shortness of breath during physical activity. 2. Angina, chest pain due to reduced oxygen supply to heart muscle. 3. Syncope, fainting or lightheadedness, particularly during exercise. 4. Fatigue due to reduced blood flow and oxygen supply to the body. 5. Heart murmur, a characteristic systolic ejection murmur heard on air circulation. 6. Palpitations, sensation of irregular or forceful heartbeats. Diagnosis. 1. Physical examination. Detection of a systolic murmur at the right upper sternal border. 2. Echocardiogram, gold standard for diagnosing AS, assesses valve structure and function. 3. Electrocardiogram ECG may show left ventricular hypertrophy. 4. Chest X-ray can show an enlarged heart or calcification of the aortic valve. 5. Cardiac catheterization measures the pressure gradient across the aortic valve. 6. CT and MRI used to assess the anatomy and calcification of the valve. Nursing diagnosis. 1. Decreased cardiac output related to aortic valve stenosis. 2. Activity intolerance related to insufficient blood flow during exertion. 3. Risk for ineffective tissue perfusion due to reduced cardiac output. 4. Anxiety related to diagnosis and symptoms of aortic stenosis. 5. Fatigue related to decreased efficiency of the heart. Management A. Monitoring regular follow up with echocardiography to assess the progression of the disease. B. Medications 1. Diuretics to reduce fluid overload and relieve symptoms of heart failure. 2. Beta blockers to reduce heart rate and improve myocardial oxygen supply. 3. ACE inhibitors to lower blood pressure and decrease strain on the heart. C. Lifestyle modifications 1. Limiting physical exertion, especially in severe cases. 2. Smoking cessation and cholesterol management. 3. A low sodium diet to reduce fluid retention. Treatment 1. Aortic valve replacement AVR. The definitive treatment for severe AS can be performed surgically or via transcatheter depending on the patient's health. To balloon valvuloplasty, a temporary measure particularly for younger patients or those not suitable for surgery, where a balloon is inflated to widen the valve. 3. Transcatheter aortic valve replacement, minimally invasive procedure to replace the valve without open heart surgery. 4. Surgical aortic valve replacement, open heart surgery to replace the aortic valve, typically for younger or healthier patients. Psychosocial medicine 1. Emotional support. Patient with severe aortic stenosis may experience anxiety, depression. Providing psychological counseling or support groups may improve quality of life. To addressing fears, fear of surgical intervention can be managed through pre-surgical counseling. 3. Family involvement, educating family members about the diseases and prognosis can improve patient outcomes. Prevention 1. Management of risk factors, controlling hypertension, diabetes and hypercholesterolemia can slow disease progression. 2. Regular checkups for individuals with bicuspid aortic valves or a history of rheumatic fever. 3. Healthy lifestyle, diet, exercise and smoking cessation can reduce the risk of valve calcification. In conclusion, aortic stenosis is a serious progressive condition that requires timely diagnosis and management to prevent complications like heart failure, arrhythmias, and sudden death. With advance in treatment, especially minimally invasive procedures like TAVR, patients have better outcomes and improved quality of life. Nursing care plays a critical role in patient education, symptom management, and post-operative recovery, contributing to comprehensive care. Thank you. Have a wonderful day.